Thank you, Dr. Mitra, for your kind introduction. Good afternoon, everyone. Today I'm here to present my seminar on the topic Mixed Nanomicelles of Dexamethasone in New Topical Therapy for Posterior Uveitis. In the next 15 to 20 minutes, I'm going to touch upon these topics. First is introduction, wherein I'm going to talk about posterior uveitis, then current treatment options for posterior uveitis, then back of the eye delivery from eye drops, then followed by the research objectives, then methods and results, and finally conclusions. Coming to introduction, uvea is an autoimmune disease that causes inflammation of uvea, and uvea is the middle layer of the eye, and it mainly consists of three tissues, that is iris, ciliary body, and choroid. And if you see here, these are the three tissues that are, and these three tissues are called uvea. And based on which tissue is inflamed, we can classify uveitis into four categories. One is anterior, next intermediate, then posterior, and panuveitis. And today we are interested in posterior uveitis, which is mainly the inflammation of choroid and retina. Coming to current treatment options, for anterior uveitis, we have glucocorticoid eye drops that are administered topically along with topical cycloplegics such as atropine. However, this mode of delivery is not suitable for posterior uveitis because less than 100,000 part of the drug that is applied topically reaches the back of the eye. So for treating posterior uveitis, we have other alternative routes of administration such as systemic delivery, then we have periocular delivery, and then intravitreal delivery. So let me quickly tell you about these routes. Coming to systemic delivery, we generally administer the drugs via oral route, and upon oral administration, obviously the drug gets distributed throughout the body, and less than 2% of the drug that is administered systemically enters the back of the eye, that is choroid and retina. So if you want to maintain enough drug concentrations in the back of the eye, we have to administer more and more doses of the drug systemically, and which obviously results in unwanted systemic side effects. And coming to next route, that is periocular route, and this route is much better than systemic administration in the sense it causes lesser side effects because it's a local way of delivering the drugs. And in this route, we place the drug in the vicinity of the eye. So periocular in the sense close to the eye. So the drug is basically placed in the vicinity of the eye via injections. And the disadvantage of this route is, in order to maintain again sufficient drug concentrations, we have to frequently administer periocular injections, which is not very well received by the patients. Then the other route of delivery is intravitreal route, and usually implants are administered by this route, and this route is much better than systemic as well as periocular route because it provides sustained release of the drug. And again, this route also has got certain drawbacks in the sense, like, in order to place the implant as well as in order to take out the implant, the surgeon has to carry out surgery on the eye. And most patients do not like to have a surgery in the eye, and few implants that are there on the market for treating uveitis are Retisert, which contains fluocinolone acetonide, and again it releases the drug until 3 years. And the other implant is Ozurdex. So this is an injectable implant system. That means surgery is not required, but the implant can be directly injected into the eye. However, the disadvantage of this system is, like, after the injection has been performed, again the surgeon has to put at least 2 to 3 sutures in order to close the hole that is caused by the needle. So these are the disadvantages of the existing routes of administration. So we need to have an alternate drug delivery system or an alternate drug delivery route which is devoid of these side effects. So scientists have started looking at alternative possible routes, and they have started revisiting the question, can we deliver the drugs to the choroid and retina using eye drops? And if you look at the literature, in the past 5 to 10 years, we can see many papers as well as patents that are published, and all these papers and research papers as well as the patent support this hypothesis. That means they prove that we can pretty much deliver the drugs to the back of the eye upon topical administration. And I have just listed few examples. We have ATG 003, which decreases angiogenesis after topical application. Then we have OC10X. Again, this is another molecule which is currently in phase 2 clinical trials. We have TZ100801, which is a prodrug which converts into TG100572. And again, the prodrug basically improves the penetration of the drug. And we have LX214 formulation, which contains oclosporin. This is a drug, and in this the drug has been dissolved using nanomicellar technology. So all these studies basically suggest that we can deliver the drugs to the back of the eye following topical application. That means, let's say if the molecule is small and potent enough and has suitable charge characteristics, then it can penetrate to the back of the eye following topical application. Or we need to have a right kind of delivery system, like a nano carrier system that can carry these drug molecules to the back of the eye. So next is project overview. The objective of my research is to design and characterize a clinically acceptable eye drop formulation of dexamethasone for treating posterior uveitis. And the reason why I have chosen dexamethasone is because it's basically a model drug, lipophilic drug, and also it is very widely used in treating inflammations, as well as it is also used in treating posterior uveitis. And we have these marketed formulations currently. We have Maxidex, which is dexamethasone suspension. Then we have dexamethasone sodium phosphate eye drops. Then we have, again, dexamethasone intravitreal implant. These eye drops are basically used for treating anterior segment inflammations, and the implant is used for treating posterior uveitis. And now we have designed a clear solution of dexamethasone, which consists of 0.1% dexamethasone, and we have named it as DEXSOLV. So if you see here, this is the eye drop formulation, which is very clear. And we have used a nanomicellar technology in order to dissolve dexamethasone. We have used two surfactants, nonionic surfactants, which are approved by FDA for use in Ocular products. These are polysorbate 80 and polyoxyl forthe stearate. So these are very widely used in eye drops as surfactants. So we have chosen these two surfactants in right proportions in order to dissolve drug in required concentrations, that is 0.1%. So coming to the preparation of mixed micelles, it's pretty much a straightforward method. It's a solvent evaporation method wherein we dissolve drug as well as polyoxyl forthe stearate in 95% ethanol, and then we will evaporate the solvent, and then to it we'll add polysorbate 80 in required concentrations under continuous sonication. And if you see here at 6% concentrations, at 6% total concentration, surfactant concentration, we were able to solubilize 0.1% dexamethasone. That means we can increase, basically by increasing the surfactant concentration, we can increase the solubility of dexamethasone. And we were able to achieve a 6% total surfactant concentration, we were able to achieve 0.1% solubility of dexamethasone. We have characterized the formulation for particle size, morphology, then in vitro drug release, stability study, sterility test, irritation potential of eye drops, and then we did some in vivo studies in rabbits. So let me go through this one by one. So coming to particle size, we have used dynamic light scattering technique in order to look at the particle size of nanomicelles. We have two graphs. On the left hand side, we have blank nanomicellar formulation, which has a particle size of around 13.3 nanometers, and the drug-loaded nanomicellar formulation is around 14.5 nanometers, and the chi-square values for these two is less than 3, which indicates that these are monodisposed formulations. That means they have uniform particle size. Next is morphology. Again, we have used transmission light, transmission electron microscopy in order to look at the morphology of micelles. And if you see here, these micelles are spherical in shape. The micelles are spherical in shape, and the size is again around 20 to 40 nanometers, which is in agreement with the previous DLS study. Next is the in vitro release. We have placed the formulation in a cellulose bag, and then we have at regular time intervals we have taken the samples and analyzed the drug using HPLC. And if you look at this release profile, the drug is getting released over a span of 8 hours in a sustained manner. Next is stability study. We have done the stability of nanomicelles in 3 different ways. First is the clarity test. This test is basically done to check the stability of micelles in presence of formulation excipients, because obviously nanomicelles, they have to be formulated as eye drops. So when we formulate these nanomicelles as eye drops, the stability of the nanomicelles is very important. If the nanomicelles are not stable enough, then there are chances of drug getting precipitated. So the clarity test is basically done to check the stability of nanomicelles in presence of formulation ingredients. Then we have next test is artificial tear dilution. That means how much the nanomicelles are stable to in presence of tear fluids. Then the chemical stability of the drug. So coming to clarity test, we have basically used phosphate buffer. That means we have diluted the basic nanomicellar formulation with phosphate buffer 2x, as well as polyvinyl pyrrolidine, which is a commonly used viscosity enhancer in eye drop formulation. And if you look at the absorbance is less than 0.1, which indicates that the nanomicelles are, which indicates the solution is clear. That means the nanomicelles are stable in presence of formulation excipients. Next is artificial tear dilution. When the nanomicelles are placed in the precorneal cavity, it gets diluted with the tear fluids. So upon dilution, we want the nanomicelles to remain intact, or else the drug gets precipitated in the precorneal area and it cannot pass through the cornea and conjunctiva. So in order to check the stability of nanomicelles in presence of artificial tear fluids, we have diluted the basic formulation with various natural tears, various artificial tears in different dilution factors like 2x, 10x, as well as 15x. And if you look at the absorbance values here, it's pretty much less than 0.1, which indicates that the nanomicelles are stable in presence of tear fluids. Next is the chemical stability of dexamethasone. We have tested the stability of this formulation at 4 as well as at 25 degrees. And we looked at the following parameters like the visual clarity, particle size, polydispersity, pH, drug content, and drug content. So if you see here at regular time intervals, we see no change, no significant change in any of these parameters. The drug content was close to 100%, which indicates this formulation is stable until 6 months at 4 as well as at 25 degrees. Next is sterility, which is another important parameter for eye drop formulations. We have sterilized the formulation using a sterile syringe filter, and then after that we have analyzed the drug content. We have made sure that the drug content is close to 100%, and then we have checked the sterility of the formulation using standard USP tests. So we have 4 samples here, one negative control, then one positive control. Then we have positive sample control, that means the unfiltered formulation. Then we have aseptically filtered formulation. So if you see here, the negative control as well as aseptically filtered formulation, there is no microbial growth after 0, 7, and 14 days. Whereas in the positive control and the positive sample control, that means these are basically non-sterile preparations, we found the growth of microorganisms. So this indicates that the formulation can be sterilized using sterile syringe filters, and it is sterile up to 14 days. Sorry, it is sterile. Next is the ocular irritation study of the blank nanomicellar formulation in rabbits. We have tested whether this formulation is causing any irritation in rabbits or not. We have basically used a blank nanomicellar formulation. We did not want to have drug in it. So we have administered 100 microliters of formulation in 3 rabbits, and at 24, 48, and 72 hours, we have looked at the eyes, and we have scored the eyes based on a modified Drace test. And if you look at here, the scores are close to 0. That means after 24, 48, and after 72 hours, we did not see any irritation in cornea, iris, or the conjunctiva. Basically, the conjunctiva was studied for redness as well as chemiosis, that means swelling of conjunctival vessels. So absolutely, we did not see any kind of irritation in any of the tissues. Then we have done ocular tissue distribution studies following single administration. That means we have administered the eye drop in rabbits, and we have seen, like, at, after 1 hour, what are the concentrations in each of the tissues. And pretty much we can see clearly a significant concentration. That means in retina and choroid, which is the target tissue, we were able to achieve approximately like 43 nanograms per gram. So that was the concentration after single administration. Then we have studied the ocular irritation upon multiple administration. That means in this study, we have administered the formulation twice a day for 7 days, for 7 continuous days. And again, we have scored cornea, iris, and conjunctiva for irritation. Absolutely, we did not find any kind of irritation in any of these tissues. And then on the 7th day, we sacrificed the animals. And here, this graph shows the concentrations of the drug that is present in various tissues. And again, if you see here, in retina and choroid, we were able to achieve like around 67 nanograms per gram of drug. And surprisingly, we were able to find the drug in vitreous humor. That means upon single administration, we did not find any drug in vitreous humors. But eventually, like upon continuous administration, the drug is partitioning into vitreous humor. So the conclusions of this study are, this would be the first clinically acceptable eye drop formulation, because both the surfactants that we have used are approved by FDA for use in ophthalmic formulations, and the concentrations that we have used are also pretty much within the limits. And we have demonstrated that topical application of a mixed nanomicellar formulation results in therapeutic concentrations of dexamethasone in rabbit retina, and this formulation can be used in treating other diseases such as diabetic retinopathy, wet age-related macular degeneration, diabetic macular edema, and PVR. And we are hoping that topical delivery of small drug molecules for treating retinal diseases will soon be a reality. Thank you.
Thanks. For the dexamethasone, can you go to this slide with the stability data? What's the osmolality of the product?
Osmolality, we have basically adjusted using NaCl close to 250 milliosmoles.
How many again?
250 to 300.
Okay. Is it buffered?
Yes, this is buffered. This is the final formulation with buffer. It's not the basic nanomicellar formulation.
What's the buffer?
The buffer is phosphate buffer.
Why is the pH 5 if it's phosphate buffer?
The pH is 5 because obviously the buffer, we have initially tried to maintain the pH, but the thing is, once we add the basic nanomicellar formulation, we are pretty much landing at that pH.
Where's the acid coming from?
Where is the acid?
If you're dropping from pH 7 to pH 5, what's causing that drop?
I cannot exactly tell you where the acid is coming from, but probably it's pretty much. Sorry, let me take my words back. This is the stability data of just the basic nanomicellar formulation. Sorry.
No buffer.
No buffer.
All right.
Yeah.
Isn't the pH drops from 5 to 3.75? Isn't that kind of low for an ophthalmic product?
Because it's not having any buffer.
Right. So the answer is the acid's coming from the polysorbates, which oxidize and create acid. So one of the main issues with polysorbates at that concentration is making sure they're clean before and not peroxidized before you use them, and you got to have a buffer, otherwise that will happen.
Okay, yeah. This is basically because we have done for the basic nanomicellar formulation, we have done the artificial tear dilution as well as the clarity test and the stability test.
You may want to look at the stability of the ingredient, that is, as he's pointing out.
Yes.
It can form spontaneously
Mhm.
the sorbic acid, and that will cause the lower in pH,
Mhm.
and that can degrade the drug.
Yeah.
Right. Your stability data show potency of the drug, but they don't show the percent purity. So that would be another thing to look at. And
Mhm.
again,
Sure.
all the in vivo compatibility stuff, if your pH is 3, I think it would bear repeating when you've got a pH stabilized product, which is easy enough to do with phosphate buffer.
Mhm.
Yeah.